Our proposal is the Armed Forces Against COVID-19. This is our team. Our objective is to create a low-risk campus environment that could exist after executive orders expire within the $5,000 grant. We plan to target campus locations that experience the highest volume of students and offer solutions that limit both contact and air transmission. These ideas are advantageous because they are easily implementable, sustainable, and build upon current infrastructure, allowing them to be scaled to other universities.
In order to achieve this goal of reducing viral infections across campus and making students feel safe, we would request $5,000 to implement our three-pronged solution, composed of land, air, and sea components, in order to combat COVID-19 using step-and-pull devices, wellness rooms, and a patient tracking system. For our surface transmission solution, we would use a product called step-and-pull, a small device you attach onto the bottom of a door so you can open it with just your foot. This device would be installed on push-pull bathroom doors across campus to reduce contact with door handles because, as studies have shown, door handles are one of the greatest bacteria carriers that we use on a daily basis. These devices are inexpensive and can be easily installed. And then looking at medical expenses data for COVID-19, our step-and-pull solution would effectively pay for itself by preventing just one student infection. For our air transmission solution, we propose converting 18 rooms in Daniel House into designated wellness rooms for housing students who become ill in order to prevent viral spread. By doing this, we could prevent the infection of the students' roommates or friends, as well as whoever they may infect. Converting these rooms would come at no direct cost to the university, with the only expense being lost room and board revenue. Additionally, we propose SMU reimburse ill students for online meal deliveries up to the value of a daily meal on campus.
Our C solution is observing student symptoms. Symptom tracking allows for early detection and interruption of a viral transmission chain. Our program utilizes the Pegasystems COVID-19 tracker that is currently being used by hospital systems. It is offered free and can be integrated into the student database within a week. The symptom tracker is easily accessible to students and faculty via email and provides them with the ability to self-monitor their health. The systematic collection of data allows the program supervisor to identify trends in student health, and university can tailor virus suppression efforts over time and location. One foreseeable barrier is the lack of student participation. This would be counteracted through a rewards program, which would offer coupons to local businesses. This program not only benefits the SMU community, but will provide a way to support local businesses in a hurting economy. The assessment will be sent out weekly via email to collect symptom data and information about contact with COVID-19 positive patients. If a student is flagged as high risk for the virus, they will schedule a telehealth appointment with the health center. If the medical staff confirms symptoms, they will visit the health center to receive a COVID-19 test. If their test comes back positive, the student will self-isolate in one of the above-mentioned wellness rooms. An automated alert will be sent out to peers the student may have come in contact with and prompt those students to fill out their own risk assessment. Lastly, students would be advised to submit an updated risk assessment every day for the subsequent 10 days, so the health center can monitor symptoms and verify when the student is safe to return to class.
We plan to add a training course on campus that would include information about each of our three solutions. In the case of asymptomatic students, universities must make students aware they can contract the virus without knowing it, and then emphasize how to prevent the spread of infection by utilizing the step-and-pull devices mentioned in common hygiene practices. Our course is designed to address these issues and increase use of our solutions. The three solutions we've outlined are implementable within the 90-day timeframe requested by the Safe Schools grant just in time for the fall semester. Pegasystems COVID-19 tracker is currently offered free to organizations, and the wellness rooms require no out-of-pocket spending. Our service transmission solution is the only one that requires funding. We plan to install step-and-pulls in all bathrooms in each of the campus halls that hold classes. Using information from SMU's website on their education of buildings, we were able to get a good estimate of how many devices we'll need. We calculated an estimated 156 bathrooms at $29.95 per step-and-pull. Per their website, we would need about $3,800. We would also purchase 500 of the flyers mentioned previously for $160 and would leave 1,040 left. With this, we would purchase an additional 37 step-and-pulls in case our estimate was low, or the wages for the workers who will install the devices.
Our return on investment calculation has three cost components, including step-and-pull purchase and installation, the loss in revenues of 18 rooms that will be converted to wellness rooms, and the cost of meals that will be reimbursed to infected students who stay in the wellness rooms, resulting in a total of about $270,000 to $283,000. On the impact side, there are three aspects of our proposal that bring value to SMU and its greater community, the first being decreased surface transmission from the step-and-pulls. Business Insider reported that the average cost of treatment for a college student that contracts COVID-19 is $3,600. Seeing as 40% of people within a facility can pick up viruses from commonly touched objects, Our step and pull will save the school and its students large amounts of medical costs. As for the wellness rooms, we found through our student survey that 12% of students will not be returning to campus unless the university comes up with a contingency plan for relocating students infected with COVID-19. By implementing wellness rooms, the university can assure student safety and recover the value of this potentially lost matriculation. Lastly, the PEGA Tracking Rewards program will increase community spending by distributing coupons. These benefits total up to $3.7 to $3.9 million in positive impact. Considering these cost and impact factors, our project is expected to deliver 14 times return on investment.
We will be utilizing a variety of evaluation strategies over time in order to ensure our success. In evaluating our step and pull surface transmission solution, we will be surveying students, asking them how often they use the step and pulls, and using volunteers to observe doors with installed step and pulls and record how often they're being used. With wellness rooms, we will track the number of students using the rooms, how often the rooms are needed, and the infection rate among residence halls. This will help in tracking how well the rooms are working in preventing transmission. For patient tracking, we will need to track the number of students who are completing the health assessment, the frequency of completion, and the number of students seeking health care at the health center. And lastly, when evaluating the impact of online training, we will track completion rates of the course. We will also check in mid-semester to evaluate the impact of the training over time. Summarizing our proposal, we are requesting $5,000 in order to implement our land, air, and sea solutions. These solutions will have great impact by addressing the various aspects of viral transmission. And as mentioned before, the implementation of these solutions will result in 14 times return on investment. We are confident in the potential of these solutions to promote a safer, healthier campus. We look forward to seeing the positive impact that the Armed Forces Against COVID-19 plan will have on SMU's campus, as well as on other campuses in the future.